Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Iron mineral. Introduction. Iron is a mineral that the body needs to function and stay healthy. Not having enough iron can cause many health problems. This is because iron is needed by many different parts of the body. This program will help you understand the importance of iron in the body and how you can make sure you are getting the right amount. Iron. Iron is a mineral needed by our body. All cells include iron. The body needs iron to grow, develop, and function. Having too much or too little iron is not good for our bodies. Iron's main function in the body is transporting oxygen and carbon dioxide. Iron is needed to make hemoglobin, a very important chemical in the blood that carries oxygen throughout the body. Having too little hemoglobin is called anemia. Iron has many other important roles. Iron also helps the muscles store and use oxygen. Iron is part of many important enzymes. Enzymes help the body digest food. They also help cells grow and reproduce. Iron deficiency. When our bodies don't have enough iron, many parts of our bodies are affected. Not getting enough iron is called iron deficiency. Iron deficiency may result in anemia. Anemia happens when there are not enough healthy red blood cells in the body. Anemia is usually caused by iron deficiency. It is a condition in which the body does not have enough oxygen carrying capacity because there isn't enough iron. This can make people feel very tired and weak. Iron deficiency is the most common deficiency resulting from not eating healthy choices. Infants may not be able to get enough iron from breast milk or formula. This may result in developmental delay, a delay of normal developmental milestones. Children and teenagers who have iron deficiency may not grow their mental abilities as well as if they were receiving enough iron. Women are at an increased risk for iron deficiency due to blood loss during their monthly period. During pregnancy, iron deficiency can cause preterm labor. In preterm labor, babies are delivered before 36 weeks of pregnancy. Preterm babies are more likely to have health problems than babies who are born on or after their due date. Adult men and women who have iron deficiency and anemia are often fatigued and tired. Meat contains iron. Since vegetarians do not eat meat, they are also at an increased risk of anemia caused by iron deficiency. Frequent blood donors are also at an increased risk because blood donation lowers iron stored in the body. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Sources of iron. The two types of dietary iron are heme and non-heme. Red meats, fish, and poultry are all sources of heme iron. Non-heme iron is found in plant foods like lentils and beans. There are also foods fortified with non-heme iron. Some cereals and oatmeal provide most, if not all, of the recommended daily intake of iron. Non-heme iron is not as easily absorbed as heme iron. You can help your body absorb more iron from non-heme sources by also taking in vitamin C. You can also get iron from daily supplements. Supplements are most often pills and can be found at drugstores, grocery stores, and health food stores. Talk to your healthcare provider if you are concerned that you are not getting enough iron in your diet. You should also speak with your healthcare provider before beginning any iron supplement. Iron supplements may affect or be affected by other medications that you are taking. Recommended amounts. Recommended daily iron intake is measured in milligrams or mg. The recommendations differ based on gender and age. They are higher for growing babies and children as well as pregnant women. A recommended amount is not known for infants 0 to 6 months old. An adequate intake amount is 0.27 milligrams each day. Children 7 to 12 months old should take in 11 milligrams of iron daily. 1 to 3-year-olds should take in 7 milligrams daily. It is recommended that children 4 to 8 years old take in 10 milligrams daily, and 9 to 13-year-olds take in 8 milligrams daily. For males 14 to 18 years old, the recommended intake of iron is 11 milligrams daily. Males 19 and older should take in 8 milligrams of iron each day. For females 14 to 18 years old, the recommended intake of iron is 15 milligrams daily. Females 19 to 50 should take in 18 milligrams of iron each day. For females 51 and older, 8 milligrams of iron is the daily recommended intake of iron. Females need to take in more iron during their reproductive years because of blood loss during menstruation. Also, women who are pregnant need to take in 27 milligrams of iron daily. The upper limit of iron intake for anyone 7 months to 13 years of age is 40 milligrams each day. The upper limit for anyone 14 years of age or older is 45 milligrams each day. Your healthcare provider may prescribe more than the upper limit of iron if you are severely deficient. You should always follow your healthcare provider's dosing instructions very carefully. Too much iron in the body can cause toxicity and requires emergency treatment. Iron overload. Not much iron is excreted from the body through waste. This means that iron overload, also called iron toxicity, can happen. There are two types of iron toxicity: chronic and acute. Chronic type happens when the iron buildup happens over a long period of time, like months and years. Acute type happens when the buildup happens suddenly because a large amount of iron has been taken all at once. Both chronic type and acute type iron toxicity can lead to liver failure and brain problems that can lead to death. In the acute type, death can happen within days. Iron overload is when too much iron is taken in and stored in the body. Iron may be stored in the liver, the heart, or other internal organs. The extra iron can damage organs. This may cause serious health problems. Iron overload can also happen because of genetic diseases like hemochromatosis, also known as iron storage disease. In one type of hemochromatosis, the body absorbs too much iron, which causes a buildup in iron. People who need frequent blood transfusions are also at risk of iron overload. These people should avoid iron supplements. If you are taking iron supplements, make sure you keep them away from children. If you think someone may have taken too much iron at once, do not wait. Go immediately to the emergency room or call a poison control center. Symptoms of iron overdose may take 60 minutes or longer to appear. You should not wait for symptoms to take action. Children are at risk for this type of poisoning if they accidentally ingest too many iron supplement pills. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Iron is a mineral that the body needs to function and stay healthy. Not having enough iron can cause many health problems. This is because iron is needed by many different parts of the body. Sources of iron include natural foods, foods fortified with iron, and iron supplements. Most people do not need iron supplements. If you are concerned you're not getting enough iron, you should talk to your healthcare provider. You should always check with your healthcare provider before you begin taking an iron supplement. Thank you for using Explain.